Andrew, thank you so much for joining me today for this project that we're calling the COVID Diaries. I appreciate your time so much. Why don't you go ahead and introduce yourself and let us know who you are?
Thank you, Betsy. My name is Andrew West, and I am a person in long-term recovery. I also work in the treatment and recovery space in the state of New Hampshire.
Wonderful, wonderful. Thank you so much. This is such an important perspective to be showing, I think, for this piece that we're doing. One of the most important things, I think. So what I've been doing in my interviews is just kind of taking it right back to March of 2020 last year. When COVID hit, the news kind of hit. Americans, everybody all over the world was kind of scrambling around and nobody knew what was happening. And so where were you sort of personally and professionally at that time?
So I was at that time, March of 20, would have been working for a larger inpatient treatment provider just south of New Hampshire, down in Massachusetts. Initially I was of the mindset, probably like a lot of other people, where I didn't know what was going on. There was a lot of fear. There was a lot of misinformation sort of floating around. So initially I didn't leave my house for quite a while. I was lucky in that the organization I was with allowed us to work from home. A lot of what I was doing was to help connect people, doing treatment advocacy work, connecting folks in need of detox and residential inpatient services. And all of a sudden we just saw this massive wave of demand. And as I was saying previously, I've been doing this for not professionally, but just as part of my own recovery for 20 plus years, 22 years, give or take. And I've never seen a marked jump. It was really an explosion. It was a tidal wave all at once of people. For me, I wasn't able to go. I do some recovery meetings. I guess previously I had always done them at least a couple times a week, face to face, in person. And then almost overnight that went away. Everything started shutting down, and we talk about it. You hear it a lot, that the opposite of addiction is connection, right? That's for the folks that maybe are sitting at home right now, or previously had been prior to COVID hitting, and maybe they got some treatment, or maybe they went to some different types of recovery meetings, and life got better for a lot of people. And then COVID hits. Some of the organizations, churches, the church basements, or the recovery community organizations, were all of a sudden not allowing folks in, and again, because nobody really knew what this was, what we were dealing with. So we had a lot of people who were, as a direct result, having recurrences of use. What a lot of people maybe before, even now, called like a relapse. And that sense of hopelessness, despair, separation returns, and the old standby, that thought kind of creeps in, that maybe a drink or a substance will make that better, and then people are off and running.
So yeah, I really I love that you bring up the point of people with substance use disorder, and I think most people would say addicts and alcoholics, suffering from this type of a disease. And we do, of course, now know that it is a disease. How important it is for people suffering with substance use disorder to connect to other people who also suffer from the disease, connect to people who are new to recovery, connect to people who have multiple years of recovery, talk about how the isolation piece, socially, we all had to totally isolate, and compounded with the fear of the unknown. Nobody knew what this virus was really going to look like. Nobody knew how it was going to affect any given person. It was really, really terrifying at first. I mean, I'll speak for myself. I work in the hospital, so I had some real fear, but, talk about that piece of, recovery, that connection piece.
Yeah, I mean, again, from my own experience, um, personally, it was really difficult. I went probably 6 months. I was kind of to one extreme in the beginning where I started to hear about this people getting sick, and maybe like a lot of other people, I was like digging. I was looking like, what is it? Where's it coming from? Why? Just looking for answers. I like to understand things, and because there was not a whole lot of good information initially out there about it, we stayed put like a lot of other people, and I'm blessed. I'm definitely blessed. I'm married. I have a whole bunch of kids. I have a big family. But wow, it was not easy. Working from home, staying around them all day, every day. We're trying to do remote learning with the kids, or homeschool, all these other things that you take for granted. In addition to trying to get some help for myself in terms of like, just staying on track. Going to meetings, my recovery meetings, connecting with people. Zoom it's definitely different than being face to face. It's for me anyway. It's definitely different. And then
I
I'm
hear a
on
lot
these
of people
calls
say
all day.
that. Yeah. Yeah.
Yeah, and I will say though, it was and it still is. It's better than not going at all. I still feel that connection.
Right.
Talking to other people who have been through it, or that are transparent and can be just kind of be real with me about where they're at, and when I'm having a tough time, different things that come up in life, I can chat with them. And so I guess in some ways it's forced maybe a lot of us out of our comfort zones, and we've had to focus on that, like again, the technological side of it. But I know firsthand that a lot of the folks who are kind of the old timers in different fellowships and recovery meetings, that can be an obstacle for them, technologically speaking. Being able to get on, even log in, or what's Wi-Fi, and they're so used to just going to their meeting and being in a routine. So for those folks, my heart has gone out to them, and also like the kind of knowledge and just the kindness that a lot of them are able to bring in terms of helping other people. Like, they're isolated, a lot of them. So for me personally, it was definitely challenging. I one of the things that I really started digging into and reading up on is like resiliency. And at the organization I was with before, I got to attend a whole bunch of like resiliency trainings, and we had this. He was fantastic. This gentleman, Christgau, that came in and had done some trainings for us. And I really started to dig into that and found, and I'm not going to try to explain it, but it won't sound right, but resiliency, that ability to kind of bounce back even under duress and like just a lot of pressure and difficulty, how many of us in recovery, or who ultimately find recovery, it's like there. It's not necessarily, and again, I'm not an expert on this, of course, but it's not necessarily something that you can learn, but if it's sort of like you got it, and if it's there, you can kind of tap into it. And so I focused a lot more on that. I focused on, some of the other things, like my physical health, trying to exercise. Spiritually, there was some stuff I was able to do that has really always helped me out. Some faith-based stuff, and then, but it was by far, I'm coming up on 15 years, and actually next month, 15 years, and this was by far the most difficult year for me in my recovery. And I'm just so grateful now that I am able to get back. I have a home group that I attend once a week. I go out with a group of guys before. We go to the local pizza shop. We just talk, and it's like the best thing ever. And a couple years ago, if you told me that would be like week after week, the highlight of my week,
A real Friday night out, right?
Right. And now I'm like, this is fantastic. Like, and it's also allowed me, and I think maybe for a lot of people out there, I know folks that I've talked to really sort of dig deep and to take a look at in our own lives and like what's important and maybe what's not, and really focusing and trying to get trying to clear a lot of that stuff that's just a waste of time or isn't kind of adding value to my life. I really dug in over this last year, whether that, work things, relationships with people, things that were, I don't know, I'm not sure if that makes sense, but it really forced me to reevaluate what was important and what wasn't, and the things that are important, focus more time on that and less time on the things that are not important.
I think a lot of people were kind of forced into looking at priorities for sure in this past year. I totally agree with that. Absolutely. I'm so glad you could, look at that for yourself and find that for yourself. You're so busy, managing kids, managing work, managing a relationship, managing recovery. It's a lot. It's a lot. I'm glad you've been able to, to find that smoother path for yourself. I'm sure it's probably taken a little bit of, it has for me, it's taken time. I'll speak for myself. It's taken some time for me to, I don't know. Yeah. Kind of get myself together with this whole thing. So let's see. So I know that you mentioned before we started recording that you were working in a facility in Massachusetts. And you also said that, things were maybe as bad as they have ever been in your experience in, addiction treatment. I just wonder if you could talk about that. I mean, I know we kind of covered the, the connection piece, that sort of one-to-one, people being able to relate to each other, an alcoholic to an alcoholic or addict to addict, and it's just such an important piece, like you just said, of recovery, and finding people who are like you, finding people who have been through what you've been through. And suddenly, it's just so much more difficult to access that. So, what were you witnessing down in the facility you were working in Mass?
Yeah. So I was sort of boots on the ground up here in New Hampshire. So still kind of firsthand watching as things started to quickly shift, and we just had a huge spike in demand for folks looking for treatment, and there just, frankly, there still are not enough beds.
So was that immediately after COVID sort of hit, or was it, in the months following, or, what did that look like?
Yeah, so it's tough to kind of separate, because it really, like, COVID really started. I started hearing about this thing in December.
Mm-hmm.
I didn't know what it was, but I started hearing about it. Fast forward, we get through to the new year, January, February, and then traditionally in treatment, this is the busy time of year anyway, January, February, March. Mm-hmm. So it's tough to say what caused it, but I can tell you right around March, April, I actually, Dartmouth released a study. So people who use drugs, I don't have the right off the top of my head, but it was like an 80 or 85% jump in alcohol use, which is readily available, and the state up here, it's very, very interesting how that entire system works. People were just drinking. Maybe they were working. They're on their Zoom call. Maybe they're a teacher and they're doing remote learning all day, and they can, have that first glass after the afternoon class, and then maybe that progresses, and then they start maybe earlier in the morning, or and we just all of a sudden started seeing this massive increase, especially alcohol. I mean, all substances, but alcohol and benzos are the two things that you really don't want to, as you don't want to mess around with. when you're trying to detox. You need to be medically separated in like an inpatient environment, and have medical staff watching you. It's just incredibly dangerous. So all of a sudden, the place that I was at in Mass, all of a sudden we have all these newer beds coming online. We got licensing approval, and then as soon as they would come online, they would just fill right up. And then you look at New Hampshire, again, we are still just completely underbedded in the state. We've seen many of the same patterns up here, where people are just, again, all substances, a massive uptick in methamphetamines, cocaine, stimulant-based use of drugs, and then alcohol, kind of the elephant in the room. So we are wildly underbedded and understaffed right now in New Hampshire.
I guess I can't say I'm surprised. And I also feel like this issue really hasn't gotten enough coverage. I don't think enough people are talking about this. You're really one of our recovery pioneers, in the state of New Hampshire. So grateful to have, a guy like you around to,
thank you.
To do this work, just kind of on the front lines of helping these very, very sick people, and, sick to begin with, and then suffering so much more within this very, very serious social upheaval, at this point in time.
Yeah. So even you look at a smaller city, Dover, and this still, I'm blown away by this. One death is too many. Okay. There were 9 overdose deaths in Dover in 2019. Okay. 9. In 2020, there were 18. So it doubled.
Yep.
And it's, and we're seeing that all over the state, So it really is. The nice thing is we have some good systems in place, better than even a few years ago. We have the doorways, different organizations and groups in the hospitals, and working collaboratively. We have the recovery community organizations. There's some on the Seacoast, there's some in Manchester, Nashua, up in the Lakes region, up in the North Country. And folks are coming together in a way that, I thought the opioid crisis of the last 7 years-ish, 5-7 years, this unfortunately is it's like a watershed moment in terms of addiction and need for resources up here that has quickly dwarfed that. And I think as the data continues to come out over the coming months and years, it's unfortunately it will prove that correct. But again, the good news is, the nice thing is that there are still services in place. There are a number of organizations in this last year who have started to pivot and offer treatment services for folks with Medicaid in New Hampshire. We have 3 New Hampshire MCOs. So that is awesome.
Your average person suffering from substance use disorder isn't necessarily walking into treatment with, high quality private insurance.
That's right.
I mean, that just typically is not a reality. So that's great news.
Yeah, it is. It's great. And I think 2021 in New Hampshire, I think we will see, I know we will. We're going to see a lot more options for folks that are coming out, which is super cool. And I know for years, at certain points, people were going to California, Texas, Florida, even Massachusetts, Maine. There's some good services up there. There are some organizations, and what I think you're going to see, or we are going to see this year, is a lot more homegrown, for lack of a better term, providers that are offering services and, detox, residential, some partial hospitalization, good outpatient, and then some good, safe, not licensed, but, recovery housing too, which is super important.
Absolutely. Yeah. A lot of people I know in the recovery community, would always sort of like get on a plane and fly far away to go to treatment. And I always wondered, geez, what's happening sort of in our own backyard? Like how come nobody, I know of a few right off the top of my head treatment facilities in the state, but not many, certainly not enough. And I know that you're kind of paving the way toward opening some, getting that stuff off the ground as well.
Yeah, I'm excited about that. We should have, hopefully by March, April, we should have some additional detox beds out in I guess the western, maybe Monadnock area. It's sorely needed. The whole state, we could open hundreds of beds, and we'd still be underbedded. We wouldn't have enough resources for folks, and especially with the alcohol. Alcohol, benzos. I mean, of course, fentanyl and opioids, but there are other ways that you can help people out, get them started. With medically assisted recovery, medically assisted treatment. Bupe and get them set up and at least get them started. But with alcohol, again, it's that's the group too. People with alcohol use disorders, the alcoholic, like I've always identified with, and I love helping everybody. It doesn't matter to me. Maybe it's because my heart, they speak to me in a way that, because I've been there, I know what it's like to have to wake up in the morning and not be able to not drink, like to be compelled to have to drink first thing in the morning, and just everything that comes with that. Sometimes that slower burn. I was out there for probably 9 or 10 years, and it was just absolutely horrible. And I know for a lot of folks, socioeconomically, just in general, the world is much different than it was even 18 months ago, 2 years ago. So I think, and time will tell, but with what I'm seeing right now, I hope I'm wrong. I hope I am completely wrong. But what I'm seeing right now is, the problem is it just continues to increase. And I feel like we made some really good progress, especially in New Hampshire over the last few years. And I feel like we got closer to meeting the needs of folks where they were at that time over the last couple of years, again, with the doorways, getting a lot of the doctors X-wavered so they could start people immediately on some type of MAT, and
which is medication assisted treatment.
Yeah. So buprenorphine, Suboxone, Sublocade, Vivitrol. Some of these, and they're helpful, and they're it's great. And then all of a sudden, this massive tsunami hits with all things COVID. And in addition, what I've seen too is a lot of providers are kind of in danger of closing, or they, as a direct result of COVID, you used to be able to have like a semi-private room, which would be like two to a room. COVID hits, and now, or there's a positive case in a facility, you're down to single rooms. Folks can't leave. They're some folks, depending on their circumstances, are doing engaged in all their clinical services on like a tablet. So kind of like what we're doing for treatment. Yes. Which again, maybe it's like us trying to do, or me trying to do Zoom meetings for recovery. I mean, it's definitely better. But I don't know. There's nothing beats face-to-face, one-to-ones, or in a group setting or in a clinical setting, process groups, like actually being in there. As much as it, when folks are in treatment, maybe they don't want to be there, but in terms of the benefits and outcomes, you can't beat it.
Absolutely. Well, Andrew, I just want to thank you for your contribution to this interview. I just really appreciate your time, and it's just one of the most valuable, important things we need to talk about right now. And also thank you for your service in the recovery community and being out there on the front lines and, doing the great work that you're doing. Thank you so much.
Oh, thank you, Betsy. I really appreciate it. And thanks for thinking of me and asking me to be a part of this project.
That's great, Andrew. Thank you so much and have a great day. I'll talk to you soon.
You too. Bye, Betsy.
Okay. Bye, Andrew.